As I mentioned in a recent parliamentary reply, MOH will also have to impose hospital charges for COVID-19 patients who are eligible but choose not to be vaccinated, and this will start on 8th December 2021. Our hospitals really much prefer not to have to bill these patients at all. But we have to send this important signal to urge everyone to get vaccinated if you are eligible. Billing will still be based on our current subsidy framework, subject to Medisave use and Medishield life claims. So it will still be highly supported and highly subsidized. Finally, let me just say a few words on healthcare capacity, specifically on the home recovery program. Response time have improved greatly. Currently, over 90% of COVID-19 patients receive their follow-up call from MOH within 24 hours to onboard them. However, there's still the last 10% who are not onboarded on time. The key is for the individuals to fill up the form.sg quickly and properly once you receive the SMS notifying that you have a positive PCR results. Fill up the form.sg quickly, and that will immediately trigger and automatically trigger the response from the HRP operations team and resolve most of the delays and most of the problems. As for those who require telemedicine consultations, the average waiting time has been brought down to around 2 hours now. I want to specifically address the concerns of one group, which is our seniors, who prefer to recover at home because loved ones are around and they are familiar with the surroundings. I want to assure our seniors that although our healthcare protocol says that by default, we convey COVID-19 patients above 80 years old to hospitals, this is a guideline, a default guideline. Where such patients prefer to be cared for at home, we want to support you to do so, including through the home-based care programs of many of our hospitals. But if we do so, we must also be prepared for the possibility that some patients who are at the end of their lives and who requested to be cared for at home, they may pass away at home. And should this happen, we will also make the subsequent process smoother. We will also work closely with NEA and some of the funeral directors to ensure that whatever revised regulations we have allow them to safely handle COVID-positive cases who pass away at home.